My mum Joyce was she was an extraordinary woman. She was very capable. She cared for lots of people. On her 70th birthday, just before her 70th birthday, she found a lump in her breast, and she was dealt with very quickly. She had a lumpectomy and radiotherapy, and had the all clear, and kind of put it to the back of her mind and carried on with her life. And she was really fit and well for almost 10 years after that. Two kind of things happened. She developed a bit of a dry cough, and she also described that she felt she was slowing down a bit, which just sort of brought her back into the realm of the rest of us mere mortals, but it was important to her. And at the same time, her GP retired, and so she chose a new practice with a new GP who'd been recommended to her by friends, and that GP made all the difference to us and to her. She didn't look at Mum and see someone who was just coming up to 80 and sort of had small levels of changes in her health. She saw someone who potentially had something that needed investigating, and who had a very good, very strong quality of life. And so she was absolutely tenacious about investigating this cough and this sense of slowing down. She sent Mum for a CT scan, and they found that she'd got a recurrence of her cancers. She read us very well as a family, the GP did. And she took what I think was quite a courageous decision, in that when she came to tell us that Mum had secondary cancers in her lungs, her liver and her bones, she put some time frames on it, which I know isn't right for everybody and isn't something that a lot of doctors are comfortable with doing, but she did say to us, I could be wrong, but this could be a matter of weeks or months. That made a big difference to us, because it meant that we were able to plan for the worst whilst hoping for the best. And it meant that Mum was actually then well for another 3 years, and it meant that in those 3 years we made the most of every moment of it with Mum, and it meant that I never once picked up the phone and thought, oh, I've got to speak to Mum now, because it just gave us an even more enhanced quality of life. And I think it's a very brave decision that the GP made, to kind of put her neck on the line and give us the worst case scenario in that way. Mum was then put in touch, because of the seriousness of the diagnosis. Mum was put in touch obviously with an oncologist, but also with hospice nurses, Macmillan nurses, and her district nurse. And I think they coordinated her care very well, but more importantly, they really listened to who Mum was as an individual. So again, they didn't look at her and see, little grey-haired lady in her 80s with a really poor cancer diagnosis. They saw someone who was really feisty, really independent, really capable, really busy. And so they sat down with her, collectively actually, district nurse and the hospice nurse came together to see Mum, and again that was really useful. And they talked to her about her end-of-life wishes. Mum was really clear in that she wanted to die in the hospice. She knew the hospice, she'd done some charitable work there, she knew people who worked there, and she felt that that's where she would feel safe. And again, they were very honest with her, and they said that might not be possible, but tell us what it is about the hospice that makes you feel safe, and we will do our best to make sure that wherever it happens, we will take those things into account. Because Mum then had kind of three years of continuingly relatively good health, she didn't feel she needed intervention. She didn't want interventions other than a regular trip to the oncologist, and they respected that. So they didn't close off doors to her. They offered her lots of things, but when she said to them, I don't want to go to the hospice for daycare because I don't need to, and I'm far too busy to go to daycare. I don't really want anyone to come and visit me every week or every month just to sit and talk about how I am, because I'm kind of all right. But I need to know that you're there on the end of the phone if I need you, and I need to know that when I do need you, I can get into the system quickly. So they didn't make anything conditional. They didn't offer support and said, but you can only have this if you follow these rules, if you use these services in advance. They said, that's fine, we'll keep in touch with you by phone. And that's exactly what they did. So every month or every few months, one of them, and again it wasn't always the hospice nurse, sometimes it was the district nurse, sometimes it was the GP, would just pick up the phone and say, everything all right, Joyce? And that meant that she had a lot of confidence that she knew who they were, she knew that if things went wrong and I wasn't around, she could pick up the phone to them. Mum was really well, right up until 13 weeks before she died, and then she suddenly started becoming acutely unwell, really. And there was a little conference about why that might be, but that all happened sort of almost away from Mum. But I know the GP spoke to the hospice and spoke to the district nurse about what it might be. Mum had had a fall and she'd given herself some quite significant haematomas on her knees. They were a bit worried about that. And they also did some blood tests and found that she got quite low HB levels and low blood pressure. So they decided that she needed a transfusion. They coordinated with the hospice that she could have an overnight stay to have her transfusion. When she got to the hospice, everybody then felt that given that she'd been so well, and they knew all of that, that this might be related to the haematomas, and she might be having a septicemia as a result of that. So they admitted her briefly to the acute hospital to see if that could be treated. When it became clear that it wasn't responding to treatment, I think the really important thing was the hospice nurse kind of followed her into the hospital, figuratively speaking, so kept in touch with her, kept in touch with the consultants and the nurses in the hospital, and got her back out again really quickly when it was clear that they weren't making progress. The thing that made a big difference about the hospice, and in fact about the district nurse care, was their freedom to act and how they used that freedom to act. So again, they didn't make assumptions about her, but more importantly, they listened to what we were saying. So she was in a really, it's a beautiful place, the hospice, that she had a room with big windows that she could look out over a pond and bird feeders and ducks on the pond. But the way the bed was configured, which was against the wall with all the pumps and the drains and the piped oxygen, her head was persistently turned the other way because she was falling into unconsciousness. So she couldn't see any of it. And I mentioned it to a healthcare assistant and said, isn't that a shame? You know, she would have loved to have seen that. And she was lucid occasionally. And the healthcare assistant didn't say, I'll go away and talk to a nurse about it, or I'll go away and talk to somebody about it. What she did was she said, well, we can do something about that right now. And so she physically, whilst I was there, turned the bed around so that Mum's head was always looking out the window. And when I said, well, what about all the other stuff? She said, oh, we can get some temporary solutions to that. And she went and did that straight away as well. She didn't have to go and ask anyone. It was within her gift. I think there were a few key points, really. I think the first point, which kind of ran through it all for me, was that nobody made assumptions about my mum on the basis of her age or how she looked. She looked like an old lady, or her prognosis. So they came and they saw for themselves, and they listened to her and to us, and they tailored care based on what she needed or wanted, rather than on what they gave they might have as a general pathway. I think the second thing was how well coordinated they were. And I think that was down to just simple things like talking to each other. So you could see that they were regularly keeping in touch about Mum. And again, that meant that Mum didn't feel, she had confidence then in all of them, and that was really helpful. She didn't have to keep repeating information, that was quite important. And it also meant that when they did need to swing into action with her, everything was sorted. I mean, it is awful to lose someone, but the fact that she had a really good death made it really, really important. And the fact that she had 3 years of really great care and really coordinated care and really sensitive care made a huge difference to us. You know, I kind of feel, well, if that's what's coming to me in my 80s, well, that's fine. It meant that I was able to, we as a family were able to look back on her life in a very positive way and not have to focus on the awfulness of her death. And that was hugely important to us. So I'm enormously grateful. I'm enormously grateful to the GP who found those cancers, because she might just have, we might just have carried on for years and then she suddenly succumbed, and we didn't have that opportunity to make the most of that time. And I'm really grateful to all the staff about how sensitive they were to her need to carry on with her life, and they didn't impose their perceptions of what an 80-year-old with cancer should look like or do.